healthcare system is faced with so many challenges, including poor data management, which has resulted in inefficiencies that have negatively impacted the lives of patients. Now, with the advent of technology maximizing every sector, fintech, agri-tech, and even health tech. Now, the question is, how can Nigeria begin to maximize data analytics to ensure better healthcare system for the country? Welcome to Tech Question Special. My name is Ibuku Bankole, and today we're looking at transforming Nigeria's healthcare system with digital data-driven solutions. And of course, I'm not going to be handling this conversation alone. I have with me Dr. Oyindamola Alimi. Thank you for being my guest today. And Dr. Alimi is an expert in monitoring, evaluation, and data analysis. And he has made his contribution in Nigeria's healthcare system through data-driven insights, improving HIV and AIDS programs across the country. Thank you once again for being here with us. All right. So, and of course, we're not the only two in the house. We also have Dr. Chukwuneku Obiti. He's a public health expert with over a decade experience in managing HIV, tuberculosis, and maternal health programs in Nigeria, significantly improving patient outcomes and healthcare delivery. Thank you also for being my guest.
Thank you for having me.
All right. So now the first question. Can you, okay, I'll direct it to Mr. Oyindamola. Can you explain to us the role of digital technology in Nigeria's healthcare system today and how far you think we have come?
All right. Thank you very much. For digital health, I think it has actually helped us to have more access. Looking at it, it has given us more access, more insight into patient level management. And looking at, in terms of coming in using technologies or technology that we've actually been implemented, we have telemedicine now. So for telemedicine, it has actually bridged the gap in rural communities to access healthcare. And looking at the EMR system, that's the electronic medical record systems, across all sites that has EMR systems now, we can now aggregate or collect patient-level data to make informed decisions. So these are some of the revolutions that have actually come into digital health. And not only looking at that alone, the health has changed, the world is changing, and digital health is one of the strong points that the WHO, UNICEF, and other funding partners are using strongly to be able to redistribute resources amongst implementing partners across Nigeria. Not only Nigeria alone, but across all over the world. Because I remember in February, there was a digital health summit that, I joined virtually, that this was actually spelled out. And this is a new mandate for program implementation going forward. Now, looking at this, in Nigeria, we know we were all used to paper-based data collection. When you go to the hospital, you get a card here, you move to this place, to that place. But now, it has changed. Because in some of the places, or let me say, the states that we implement, currently I work with Health System Consults and Limited, and we implement a USAID funded project in 3 states, Sokoto, Kebbi, and Zamfara states. And in all our 37 facilities or hospitals that we have our patient access care, we have a full functional EMR system. So in terms of data availability to inform decision making and resource allocation, even patient management, I know Dr. Peter will speak more to that. We have now more insights to this one, to this, because for instance, now I know what is the yield in the red LGAs. When we are talking about the project is looking at accelerating the control of HIV in Nigeria. And we have 3 states in the northwestern Nigeria. So what we did was to go in and start testing. Just start testing, and ensure that you can bring everybody to treatment, those who are positive. But in the second year, we needed to sit down and look at, let's re-strategize. Based on the data that we have in the first year, and based on the data that we have from the NICE survey, that's the National HIV Survey that was done in 2018, what is the number of people currently on treatment that we have? What is the estimated body for this particular state? We broke them down to the LG level. Now, the difference is now the unmet need. So the unmet need now is what we need to, we needed to look for strategies to implement and bring these people to care. Now, the UNAIDS standard is first 95s. We have 3 95s. The first 95 is looking at those people who are HIV positive are tested. The second 95 is looking at out of those who you have tested that are positive, you retain them on treatment. And the third 95 is looking at out of those people who are on treatment, ensure that they are virally suppressed. So this is the goal that we drive with. Now, looking at this, now that we know that we have an unmet need, using our Power BI tool, with our DHIs, with our EMR system, these are digital solutions that has helped us to have an insight about program implementation. This has actually helped us to now redesign, or let me say reinforced, our strategies for the second year of implementation, which actually gave us a very good yield and also resource management in terms of. So digital health is something that it is here. We need to stay with it. And it has actually revolutionized our program implementation. Thank you.
So thank you so much for that. Now, but you spoke about telemedicine. You spoke about, being able to make projections in the second year using Power BI tool and other tools, and which is really great, which shows that, of course, digital tools help, the healthcare system.
Okay.
But I mean, like you said, you work with HSCL,
Yes.
but that's like private. Now, the thing is, how many Nigerians can afford private healthcare, right? I know it's pretty much, maybe, of course, you have the backing of global organizations and maybe
Okay.
it's at a reduced rate and all. But the truth is, how many people are aware of that, one? And secondly, how many of them would be able to access the care? So now my question to you, Dr. Chukwuneku, is what are the challenges that you have faced so far in implementation, in getting people aware, in getting them interested in knowing whether it's for HIV or tuberculosis, in getting people aware and being able to understand the importance of the healthcare using like digital solutions?
All right, thank you very much. So, as a health professional that has implemented across both southern and northern regions of Nigeria, I would tell you one thing for free. Increasingly, we have a dearth of healthcare workers in Nigeria. When I say healthcare workers, I'm not just talking doctors, talking nurses, and every other allied medical services provider. Now, what do we do? Because the numbers are dwindling, it means that facility waiting time increases, right? Which means patients need to wait for a longer period of times before they get access to the doctor. Now, the law of diminishing returns setting. You see a doctor come in, you see he has 300 folders piled on his table. Yeah. Before he sees the first 50, he's giving them his best clinical knowledge. By the time he's going down, you see that the skill of his practice begins to really diminish, not because he's not a good doctor in terms of knowing the skill, but because he's human. The human factor begins to set in. And that is why, as a healthcare professional, we had to think outside the box. Increasingly, you are seeing many of us branch out of clinical medicine into other tech spaces, because we're trying to reach more people, seeing that our population is currently we're endangered species. Let me use the word permission. So now what do we do? For example, when I met Mr. Alimi, we brainstormed on this because we were working in 3 northwestern states, highly security compromised, with non-permissive environments, difficult terrains. Even the access to internet and telecommunication was terrible. One time in Zamfara, they had to cut out and pay for up to 6 months.
Yeah.
Do you understand? And imagine how you intend to navigate through these processes. So using his tech inputs and my clinical acumen, we're able to develop an app solution where we had patients come in. We do online consultations all across the country, not even limited to. We did all of this from Zamfara State.
Yeah.
Wow.
We had patients coming in from Edo,
Mhm.
Lagos, Ogun, consulting on the app, right? At very minimal stipends. I think we charge 500 naira. I think 500 naira
Yeah.
is
Wow,
basically
which is
affordable
Yes,
for
500.
for almost everybody in the population, because the aim was not to make money. The aim was to do what? Increase access to health. To date, we still have clients that I've never seen that still reach out to me and say, "Hey doc, how are you? Can I give you this as a service to humanity?" You understand?
Yeah.
So now, this is just giving you like a success story of what digital health has helped us accomplish using the synergy of infusing digital health technology into clinical medicine. So what are the challenges we have? I just gave you one: the access to quality telecommunication and electricity. Of course, we know that without these two things, it's difficult to access digital health platforms, right? Two, when we rolled out that app, the challenges we had with clients was surrounding their identity security
Yeah.
and information. How do I know that you are truly a medical doctor? Do you understand? So oftentimes to calm the client, I give you my license folio number. So go and check the NDCN website. You'll see me there. You will see that this person is truly a registered health practitioner, and that sort of calm the scenario in terms of trusting the clinician that this person is actually a qualified personnel, right? Now, on the other end of identity theft management and personal information security, leveraging again on his input as an expert in the field of tech for medicine, for health. I know it's the same to for medicine, for health. He was able to make sure that those information were end-to-end encrypted, such that all clients can be rest assured that whatever they divulge to us is rightly is secured, and we don't have access to all of that. So that's the challenge. One, electricity, telecommunication, and the third one is what? The knowledge. Many people are not aware that there are digital solutions out there to help them at affordable price. I'm sure you're just hearing that a doctor provided service for 500 naira. Do you understand? And this we get feedback like, "Yo, I'm okay now," right? And that's the joy in it for us as people that are in the public health field. You understand? So understanding knowledge for the general masses of what digital health tools and services are out there, security in terms of identity protection, and what telecommunication, electricity. If we can have all of this sorted out, I think that we are on the roadmap to successful digitalization of health in country.
Okay, so you said something about creating an app and which has provided solution. So my question is, there is the consensus that of course there is need for more penetration at the rural level, and Zamfara and some other northern states they are not as digitally savvy as many other western states. So my question is, how possible is it to expand these digital solutions to rural areas in ways that even the person who can't even speak English can easily access this healthcare?
I know I've worked in the northeastern, and now I'm in the northwestern. So what we do is providing humanitarian services, leveraging on support from international and local donors. Now, on the setting of HIV, under the umbrella of Health System Consult Limited, where I work, right, I oversee the Anti-Retroviral Therapy Unit. Now we have the ACE grant, which is funded by the USAID. We're implementing to make sure that everybody in these 3 states have access to HIV care, testing, treatment, and care, right? Now, so what do we do in this case where we have people that don't even know how to use internet and app, right? So when I got to the state, of course, you first of all do a needs assessment, right? So where you elicit what is available, what you need to work on, and you get feedback from the end users on the expectations, because they are the one that you're going to deploy those services for. You get? So after you have all those feedback, for example, when I discovered that clients were finding it difficult to come to pick up their drugs during their routine hospital visits, right? Why? Because you have bandits attacks. You hear clients saying they were coming to pick up their drugs, they got kidnapped on the way, all manners, insurgency, high cost of transportation. So what do? I say our need assessment entailed doing a survey. So on that survey, we did over a 2 weeks period. Every client that came to the facility, you ask them, what is the average waiting time, right? How much does it cost you to come from your house to the facility, right? What is your idea of a convenient healthcare delivery method that will suit your need as an individual? Now you see, we're not looking at the collective. We're looking at client-centered care. Now, at the end of all of this survey, we pull out this data and give to the data experts. They do all the analysis and say, okay, these are the call-outs from this survey, and we use that to develop a model that we're running with now called the camping model, right? So we're now taking the drugs to the clients at the community level. Do you understand? So we to do this, because of this high security, volatile nature of this region, we have to work with stakeholders at the state government level. We have to work with local security agency partners. The USAID has graciously funded us with a security partner, PLSO, that gives us security intel that guides our movements. And as an organization, HSCL has also invested strongly in security departments. So all of this help guide the team on areas to go. So now what he does, since we have an EMR system, as a clinician, I tell him that this is the month of May, right? I say I'm expecting 1,000 clients the month of May. I give him that data. He uses machine learning and predictive analysis to analyze trends and tell me clients that are liable to miss their appointments. Looking at historical record. This client is so this client is supposed to come on the 13th. In the past, this client have been shown not to keep to his appointments. So those clients, he flags them out for me. Then we dump it on the map. So the GIS gives me a spread of these clients. So we look at LGAs that have a high concentration of these patients, then work with security agencies and move out. Now that is giving you like the operation model that we're using to deliver. Now for the virtual platform, because we don't have a lot of clients that are internet savvy, we rely heavily on the WhatsApp group platform. Almost everybody is on WhatsApp. So we have WhatsApp group where we have pharmacists. Me, a doctor, I'm there. We have consultant clinicians from the government. We have facility persons on that platform. So by the consent of those clients, we add them to this group. So where they do not want to come to the facility, but they have challenges and they want to maintain their anonymity, that is the benefit of digital health.
Digital health, yeah.
You can just put your question there. Nobody knows who you are, and the healthcare professional will reach out to you in your local dialect, which is Hausa. So when we prepare IEC materials, information educative materials, we prepare them in the local dialects and we dump them on that WhatsApp group. Do you understand? So people, for example, begin to see that, okay, there are services available in the States, maybe for gender-based violence, for pre-exposure prophylaxis for HIV/AIDS, for immunization, HPV vaccination, and all of that. So at that grassroots level, using the basic technology that we have, which is WhatsApp for now, we are able to provide this level of support. Also, there are other sister organizations that invest in maybe nutrition. You partner with those guys to see how you can provide services. Sometimes we have to partner with one organization that invested in transportation, logistics. So what those people do, they provide the transport to move those patients to the nearby facility to access care.
You said something earlier when you spoke that waiting time has reduced for your centers. But I've gone to government hospitals in recent times to see my friends, and when I have friends that, so we had to rush them somewhere, what's the cheapest place to go? And then the waiting time is a lot, and then we're still passing papers around. So, I mean, what do you have to say as regards that, and how government can begin to maximize it? Because they say the government has the most money to do many of these things.
It's okay. All right. So thank you very much. So last 2 weeks ago, we're in a conference. It's a digital health conference summit here in Nigeria. It was from USAID through DataFire. So, and government of Nigeria was actually invited, and based on the tone I'm seeing from the government of Nigeria now, from the Federal Ministry of Health, I think everybody's going towards digitalizing our healthcare system, because it came out strongly in the 2-day activity that the government is looking out to actually build their own EMR system. Now, when they build these EMR systems, I was told in the next 4 years, they want to scale to about 80% of the government hospitals, both tertiary, primary, and also secondary. So if this solution can actually come from the government, and I believe funding will come from both USAID, CDC, DOD, and even the American people in general, and also WHO. Because looking at digital health, it is the future. The future is here. It is here. Digital health has now helped us to, in terms of waiting time. Now, looking at the number of patients, he said something about the number of patients that visited the facility, and now we've been able to have an algorithm that tells us that this patient is available. It's due for an appointment based on the drug refill he or she has in the past. And if the person is, for instance, now the person is supposed to come 12th of June, and because of the adherence and reaching out through the IAC materials that have been distributed, and he knows the importance to his or her health now to come early to pick up our drug, it will come in probably first week in June. So in this analysis, we can now see that we have more pre-appointment than people keeping to their appointment, meaning that a lot of people are now educated to come to the facility without you or with low or minimum supervision. Because in our program implementation, each patient or each client is attached to a case manager. So a case manager is responsible for the care of that patient. So what digital health has made us do, what we do before is that a case manager will just have a pen and a paper, or like a log. We use a log before. It will write all the patient there. For instance, a patient, a case manager has about 100 patients she's or he's managing. And he has to now be going through to know the one that is due for viral load, the one that is due for refill, the one that is due for GBV, cervical cancer, and everything. But with the advent of this new technology, harmonizing and nursing all this together, bringing the patient-level data from the EMR system, currently we run on Lamis Plus, on the HIV project implementation by HSCL now. So, and looking at the aggregated data that will collect through DHIS is a web platform. So what they do is that for daily report comes into the central server through the DHIS. So bringing all this data together can tell a case manager on an app now. A case manager can say, okay, I have 2 patients that is due based on a push notification that is due for viral load sample collection today. These are their names. There's a phone number, and I can reach out to the person. Do you understand? It is a little bit more easy to track patients now.
And it's less stress on even
for the case managers. So it has increased their productivity too, and actually improve our patient adherence to care. Basically, I think we're on the right track, and let's watch and see.
Okay, now you were. I saw the video of the event that you
Yeah,
attended,
the
and,
Digital Health
yes,
Summit.
yeah, Digital Health Summit.
Yes.
And you said that government officials were there, the Federal Ministry of Health representatives were there.
Yeah.
Now, as much as they say a lot of things, there's the complaint in Nigeria that we hear a lot of things. I mean, there's a lot of pen to paper to say some things, but we don't see implementation. So what's your advice to, let me ask Dr. Chukwuneku first, what's your advice to the Nigerian government on ensuring implementation? Because there's so much we can say, and there's so much money that can be earmarked for certain projects, and then they don't see the light of day. And unfortunately, a lot of us Nigerians are not informed enough because there's no awareness like there was early 2000s when HIV just, what's the word now? That just, was discovered in, Nigeria. But these days, we don't even see awareness as regards, government projects, what we should be doing. So what's your advice?
We cannot do the same thing using the same methods and expect the same result, right? Over time, when I attend different forums, you hear them saying policy, advocacy to policy makers, to formulate policies that are blah, 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 right? For me now, at the field level, I like to be realistic. I think, again, it's my personal opinion, that we should approach this using the bottom-top approach. We've been going the top-bottom, right? Bottom-top means you are going from the grassroots upward. And that is what we are doing using the funding from the US aid, right? For the project I told you that HSCL is implementing in these 3 states. So how do we approach this, right? Now at the grassroots level, we are providing these services. We are partnering with stakeholders at the government level. We are partnering with the private hospitals association at the state levels, right? So what are we doing? We're doing sensitization, demand creation, and all the rest. Now, when you have all of this data, we're picking data. The best way to approach government is to approach them with data. When you approach them and say, this is our findings from our implementation so far in these states. This will now be enough evidence to say, okay, can we now reject this and see how we can scale up for the whole country? Now, why am I saying bi-directional? Because sometimes governments put certain policies, they even provide funding, and the general population is not aware that something like this is in existence. Yeah. Do you understand? Mm-hmm. So now that we're tackling these problems at the grassroots level, which is what the funding is anyways, in the spirit of sustainability, right? Yes. Such that when HSCL is 3 projects funded by USAID is over, because it's a 5-year grant, the stakeholders can continue to run on the mandate. And that's why you hear me saying that our own strategy involves bringing in stakeholders from the government and the private arm, right? So the first year we led, they observed. Right now, they are leading, we are providing technical assistance to correct them here and there, say do this, do that, so that when the project phases out, right, the states can begin to run. Now, the TB testing that is currently ongoing, we did some level of TB trainings, right? In the past, I will be the one that will go and facilitate, right? But what did I do now? Yeah. We got facilitators from the state government. We got facilitators from the health facilities. What are we trying to do? Come and talk to your people in the language that they will understand. We have trained them, right? So now they are now cascading that training to those people. What do you think will happen at the end of the day when we finish our projects? Those people have already been empowered. So in the spirit of sustainability, they are running that. While we carry our data that we have we've gotten from this region, engage with the state governments, engage with the national level, that will now be the basis for which they can now use to say, okay, this is what is informing the policy changes that we need to bring in to ensure that the digitalization of health has come to stay, right? So with all of these interventions that we have ongoing, the future is bright for digital health. I tell you for free, from the clinical point of view, because it's helping us. This data at this community level have created awareness for them, right? So coupled with our own voice in making advocacy to the government will always come and take information from grassroots levels, right? That will now make the whole, I don't want to use the word, I don't want to sound like adulta, make the whole request for change to come faster from the government and help them do what? Make policies that will be useful to the general population at the grassroots level. So that is where digital health is going to help the country, because we can sit down in Abuja now and just say, we think this is how immunization will work.
Yeah.
But with feedback from grassroots level, say, no, this thing that we're saying, this is what the people said that they prefer. So it will now tailor guide how the policies will be provided at that level. And it will now bring programs that are useful, impactful to the end users at that grassroots level.
That was really, what's the Gen Z word? That was deep. Okay, so what's your advice to, I mean, you said a lot. What's your advice to the government and also even to Nigerians?
I will start with one of his highlights, which is feedbacks to the state government, or not even state government generally, it's the government. Currently, HSCL has actually invested in dashboards that are automated in all the State Ministry of Health in the 3 states where implemented. So in terms of infrastructure, number one is power. In those remote LGAs, in those remote areas where we have hospitals, the PCs, there's no 24 hours light. So what we do was to install solar panels, and that has actually helped us to solve this. So for them to even start, they need to conquer electricity. We know we don't have 24 hours electricity in Nigeria. And the band aid that you can, I'm very sure none of them will be able to pay for that kind of consumption of So that's number one. Number two is, change is the fault. A lot of people, a lot of healthcare workers are so used to the traditional approach of writing, where is the patient card, this, that, and that. This was actually the first time I worked on a digital health solution, or let me say an EMR system, was in 2016.
So the electronic medical
record system was in 2016, and it was piloted in a very, very big teaching hospital in Nigeria. I don't want to mention it.
I feel like I can guess.
But do you know that the so-called consultant or doctors, I'm sorry to the profession, will say, after seeing 2-3 patients using the laptop or the computer, they'll push it one side and like, no, slowing me down. Let me go manual, because you have a lot of patients that you want to see. No, so now coming back, we've learned our lessons. Coming back, what we needed to do is that even you have a point of care system, a POC system in the facility, that the lab will enter the test result, the clinician or the doctor will make the request, the nurses will do the triage and enter out everything there. At the end of each clinic day, we still have a staff that is paid by the implementing partner to actually review the folders again to ensure that no data is lost. And with this, we keep giving feedback, doing retrainings upon trainings, to make this better. So my advice to the government is that they're going to invest heavily, not only on infrastructure, but training and supervision. So this is where Nigerian factor will set in.
Comes in. I think that's a civil service or public service issue. Because are they willing? It's one thing for change to come. Are you willing to accept the change or fight it and say, no, we don't want it? We said we don't want it. Yes. But honestly, sorry to cut you short. I just remember that there is a hospital around Yaba in Lagos that has that well, I wouldn't say it's 100% automated, but I mean, they're doing a good job. You have to, enter your data with your card, and then like you see the doctor. Before you even see the doctor, your name has to pop up on the system, and then you check your blood pressure, your vitals, and then you move on to see the doctor. And then if you need to see a specialist, you have to go to the specialist office and then wait till he gets information about you. I mean, so I would say they're getting there gradually, but I mean, at what pace?
But let me ask you a question. Is that a private facility?
No, it's a government hospital.
Wow,
Honestly,
wow,
it's a government
that's
hospital.
so actually that's a good one.
Amazing.
And I
Very
will
good.
want
Wow.
to. Okay, so now for that, now let's now switch to the tech part. Technology is not cheap. I will not lie to you. Now, you have a system now that is working in that kind of hospital. If Nigerian government is now saying they want to have a unified EMR system, how do you think data migration will happen from the new to the old? Or how would you look at the interoperability between the old and the new?
I think you should be able to understand all that. Technical.
So
Those are highly technical.
Yeah.
so those are the things that we need to look at. And funny enough, I think the Nigerian government is getting there. Like, for instance, NACA, I have a friend that was just employed in NACA, and it's one of the guys I respect the most in terms of programming. He's a developer. Now was employed by NACA, snatched from the private to NACA. I was like, wow. So I was chatting with him. I was like, don't worry, we need to, redesign it. So meaning that they're not going for the good HR now. Do you understand? So Nigeria is now bringing in good guys that can actually set up the system.
Experts.
Do you understand? Experts. And we have a national data repository that whatsoever I do or we do in all this funding mechanism facilities syncs there. So I go there every morning, I log in with my data, and I see that we have probably about 1.8 million people on treatment in Nigeria. We're currently on HIV. And we have CDC, everybody keeps pushing their data there. And this is championed by the Nigerian Ministry of Health. Now, having that kind of specialist in-house will help them design a better system. And you will not design and bring to me as an implementing partner, but I will give you the measure, I will give you the standard for my country. Do you understand? So those are the things that I think, saying those two things, I think Nigeria is changing. Let's just keep looking expecting the best.
So it's not that. So Nigeria is not that bad.
Yeah.
Right?
No.
Okay, so we're changing. But I mean, how many of us in Nigeria? How many Nigerians are aware of these changes and improvements? That's another thing about awareness and giving people or enlightening the public that this is how far we've come. This is what is going. Not everybody is interested in thinking of going to Federal Ministry of Health to start checking. What's the update?
That's why I said grassroots level.
Grassroots level.
Yeah.
You cannot overemphasize the role of grassroots level implementation.
All right. So thank you so much for being my guest today, Dr.
You're welcome.
Chukwuneku Obiti and Mr. Oyindamola Alimi. Thank you so much.
Thank
I really
you.
appreciate it. And we really hope that going forward, we'll see more improvement in the health sector and see how technology is being maximized to ensure that there's a better healthcare system in Nigeria. So, I mean, it's been a great session for me today, and I believe that it has been for you as well. And so, everyone, you can join us on YouTube at Tech Question TV, and make sure you subscribe and turn on the notification bell so that we can, you can get notified not just about our shows in terms of Tech Question Special, but we also have Tech Gist, Technovate, and other shows that you can enjoy. My name is Ibukumbankole. Join me again for another interesting edition of Tech Question Special. Bye-bye.